Warning. This will be talking about topics that might trigger you. Be aware before continuing on watching and listening to this episode. Thank you.
Hello, everybody. Thank you. Again, we're fortunate to have Dr. Kelly Everson here down in South Florida in Jupiter. We highly recommend you reach out to her practice. She's amazing, and we're very excited to have her here with us today. So today's chapter 3, we're going to expand on childhood mental health issues and treatment. And actually, this one kind of pivots and works with us. We have Dr. Everson, I don't know if you knew this, is that one of our programs we're doing with universities around the country is we're trying to put a national case study together to support guidance counselors and social workers in school to spot the problems, because as we know, there's usually underfunded, and like you said, the system has issues that goes to improvement. And the common research that our psych students and social worker students are coming back is that when they ask for the major pain points in the schools, the answer is, well, our budget is, we don't have a lot of funding. So we're trying to find out how can we, since we're grassroots, how can we work with the knowledge of experts such as yourself, NAMI, and other professionals, and do our own and give real life experience to people that want to follow in your footsteps as a professional practitioner. So I guess a good question with this, so we'll be able to introduce into our case study, is, I guess, starting in, if we break it down to, because when I work in the underserved communities and I do different type of gang outreach or trying to help out, there's different problems that come in with the different demographics. Sure. Because of economics. So I don't know how you want to break it down, but maybe give me what you think is the 5 or 10 of the most common mental health issues that you're seeing kids coming in that need treatment for, or that we should be on the lookout for symptoms.
Sure. So I think unequivocally the number one, especially in this day and age, not only because of COVID, of course, now, but even before COVID, is anxiety, 100%. So, I tend to think each next generation faces more and more stress, especially academic stress, than the previous generation. The kids of this generation are under a ton of stress to perform, super high academically, in sports, in extracurriculars, in everything. And so anxiety overall.
When you're going through this, since you're going to list 5 or 10, can you give me one example of a coping skill for each one? That'll be a good thing for parents that maybe are not in South Florida.
Yeah. So anxiety's got lots of different coping skills, which is great. But for anxiety, so like I said, anxiety rears its head for so many kids of across the board, all ages, all demographics, everything. The expectations of our kids, and then you add on things like COVID and stuff, and we've added on a whole nother level of difficulty for kids. So anxiety is my number one. Like I said, there's 100 coping skills that I teach kids probably for anxiety. The backbone of all coping skills is deep breathing. And I don't mean to be, the quintessential kind of like stereotypical therapist on here talking about deep breathing, but it really is 100% the best coping skill out there, because it hits the physiological part of our coping as well as the mental part of it. And so by deep breathing, we teach kids as young as one, honestly. My son is a toddler, and he knows how to take a deep breath. So we teach them littles all the way through, and adults, we teach people to breathe through their nose as slow as possible and out through their mouth as slow as possible. With little kids, we do things like blow bubbles, where they're like imagining things and all that kind of stuff. So we'd use metaphor for stuff, but deep breathing is probably your number one coping skill across the board for that, for sure.
And I think that for all ages, because I used to do
yes.
When I trained some of the Navy SEALs, that's what they used as a de-stressor.
Absolutely.
And stress.
Yeah. That's why I say I don't mean to be kind of stereotypical, but it really is literally the number one coping skill you can use for many different situations, because it not only calms the mind down, but it actually calms your body down. And so it really is such a, people think it's kind of hokey and like, oh, stop telling me to deep breathe and stuff. But in all honesty, it's probably the best coping skill that you could have somebody really, really regularly try to practice and stuff as well. I think after anxiety, we see a variety of different things and kind of depends on the situations and all those kinds of things. We of course see things like attention deficit and difficulty focusing. That's another huge one that we have. Again, that's kids and adults. That comes from work, that comes from school, that comes from everywhere. ADHD, a lot of times, many people are medicated for ADHD, just like they are for a lot of the other mental health concerns. But at the same time, we can teach executive functioning skills with kids as well, which by that, we're actually teaching things like helping them organize their time. Time management is huge. Making to-do lists, setting reminders on your phone, teaching kids how to take notes when they're reading, things like that. I mean, those are all, examples of kind of executive functioning things that can help kids through all of that stuff as well.
At what age does this usually start? Would you introduce this to a patient at like would a 5-year-old, 6-year-old comprehend that?
As soon as kids are in school, they can be taught executive functioning skills. And they are, by the way, in most school programs, starting in preschool programs, we teach kids to start organizing their thoughts. So if you think about it, even from like little on, we have kids do like wall calendars and organize like, this is the weather, this is the day, this is that, right? That's the start of really of thought organization. It starts even earlier than that, when kids learn things like puzzles and they learn things like play, imaginary play and stuff like that is really important to all this. So it starts really young, but by preschool age, we're actually really working on helping kids organize their thought and organizing things as well. And then we just continue on up, after that, the older they are, for sure.
Do you have a favorite reference, like a book for a parent that maybe they can pick up at the library as a resource to read up more on that?
There's a ton of them, and I can grab one. I'm not right by my bookshelf, unfortunately. I have 100 of them on my bookshelf in the other room next door. But there's amazing books, and you can get them on Amazon, by the way, tons of them. There's amazing books on coping skills for kids, executive functioning, like ADHD for kids, basically, and it actually like teaches them these skills. I have, different things. I may even have them in here. I have things like teaching, I give kids, actually here, I have one in my thing. I give kids little pieces of paper and they say, so this one says blow calm bubbles, and it actually teaches them how to blow bubbles, how to do deep breaths. And it actually gives them a visual metaphor as well. So kids learn with visual as well, really well. So, we have these things tucked away, everywhere in the practice to teach, to help kids understand, a coping skill isn't scary, and it doesn't have to be super therapeutic and all these things. What a coping skill is a distractor from an uncomfortable feeling. That's what a coping skill is. And we all face uncomfortable feelings all day, and if we let all of those uncomfortable feelings turn into big things, then we're melting down all day, or we can't handle, we get to this point by 8:00 in the morning, we're already here, And so it's important for kids to understand that feelings are temporary, adults to understand feelings are temporary. The human brain is amazing in that it doesn't hold on to feelings for long term. So, even in a total meltdown mode, it's temporary, because what happens, either we move on, we distract ourselves with something else, we fall asleep or something like that, because the brain just shuts down, right? If anybody has panic attacks or something like that, that they know typically after intense emotion, they crash, right? Think about a baby. Babies are great examples for the human body, because the same thing happens. But, what happens when a baby is super, super upset? They poop, they throw up, or they fall asleep. Like, that's really what they do, right? And it's because the human body can't sustain that emotion for long term. And that's a good concept for adults to understand as well. When we're feeling these really heavy emotions, if we can find a coping skill or a distractor to just move us on for like 10, 20 seconds, even sometimes, that's enough for the brain to click off and move on for a bit. It doesn't solve the problem per se, but it gets us out of that uncomfortable space for a little bit so that we can keep moving, if that makes sense.
Perfect.
So there's that. Some of the big things in schools, though, honestly, with kids are things like sensory overload and things like that. So it's not necessarily, and that can happen under ADHD or under autism spectrum or under, variety, anxiety, depression, anything like that. But, there are a large percentage of kids that have difficulty with sensory, input, and when it's too much, they shut down when it's too much. I don't know, pre-COVID, I don't know how much time you spend in middle schools or high schools, but you walk into like a lunchroom or something like that at a middle school or a lunchroom especially, and it's complete chaos. There are hundreds of kids trying to eat lunch in one large room oftentimes, and it's loud and it's completely chaotic. Kids can't get through lines to get food. They're hungry. They can't find their friends. They're having social difficulties. There's going to school for a totally neurotypical functioning normally functioning kid is a lot. It's a lot of input all day. And when you have a kid who's struggling with anything else, or who's struggling with something that's happening at home, that puts them at a disadvantage. And the vast majority of kids have real life happening to them, and that puts them at a disadvantage when they're sensitive to the sensory input, that is school. And so sensory input, we can teach kids like how to take, first of all, the number one coping skill is identifying that you're uncomfortable. That's the number one. So I do a lot of scaling with kids and adults. This is super helpful for adults as well, but understanding that we don't go from 0 to 60 immediately. There's a whole middle ground there. And so a lot of times people feel like they fly into a rage, or they they throw themselves into a panic, and it comes out of nowhere, they say. But oftentimes what's happening is that they're not noticing all the warning signs to what that is. And so when we start helping people slow down the process and understand that, like, okay, if I'm going to use a scale of 1 to 10, for example, by the time I get to a 5 or a 6, I must be using coping skills, because by the time somebody's at an 8 or a 9 on a scale of 1 to 10, they're melting down. And at that point, a coping skill is not going to work. They just need to like take a chill for a bit. Like they need a reset, So helping people to understand what are the triggers and like, how do I get there, and what's the buildup that happens, I think is huge. And that, is the core of coping skills as well.
As my disease starts to progress, I'm becoming more and more hypersensitive. Is that falling under this category, what you're talking about?
Yeah.
So
Yeah.
if I walk in a room, or if you're in a bad mood, and or a shopping mall or something like that, I can actually feel the energy. So I just learned to push through it, and I call it my mask. I just put a mask on so I don't look and scare people and let my true feelings out.
Sure.
I just put it out and get out of the place as soon as possible. So what is that the same thing as a kid can be feeling?
Oh, totally. So we have to, we try to teach kids to help identify those triggers, right? Like, so if you walk into some place and it's super loud, or it's hot and I don't like being hot, for example, or the fluorescent lighting that's in a lot of our public places, especially, is really sets off a lot of people. Fluorescent lighting does. And so just, those are just a couple of examples, but there's tons of them. But, helping somebody to understand what they're sensitive to is super important, because then they can say, okay, well, I still need to go to school, or I still need to do my life. And there is going to be fluorescent light sometimes. So at least when I see them, though, then I know maybe I should start doing some deep breathing as I'm walking through, or maybe I should, do an errand and make sure I get outside for 10 minutes before I go in another one, for example, or go for a quick walk. I need to make sure that I'm being healthy. So I'm getting a snack, or I'm getting a drink, or I'm, getting some exercise during the day. All those kinds of things help keep sensory issues and things like that at bay a little bit. But, the healthier we can keep our mind and our body and our, everything, the healthier, we can be in order to handle, crisis of any kind, big or small. Yeah.
Okay. You got any other ones that you got flagged? So that was 3.
So the other ones, I would say,
depression?
I would definitely say depression. So most people are not always aware that depression looks like irritability and anger the younger the child is, oftentimes. So oftentimes we don't look for kids that are sad. We look for kids that are mad. And because that is the default emotion for younger kids. And so we see kids who are in situations where we would, and we would call it depression after knowing what it is, but oftentimes, they're mad at the world, they're mad at the situation, and they'll oftentimes show a lot more irritability instead of true sadness, like we would potentially see in more of an adult as well. So most of those coping skills I've been talking about for that fit with depression as well, 100%. But, obviously there's an added layer to it because, with depression, we don't always have people who are able to motivate themselves to do some of these things. Sometimes I'll give one of my favorites recently. I learned this from a seminar I went to at the VA hospital, actually, and what they're using to treat veterans with PTSD. And one of the things that they do in the VA hospital is that when somebody is having a flashback or something like that with PTSD, they make them hold an ice cube or put their hands under ice cold water. And what that does is it actually stops the pathway to that, and they're actually finding that it kind of does like a jolt, and it stops the emotional response that's happening as well. And so I've actually tried it with a bunch of a little bit of my older kids, my teenagers and stuff. And I have multiple kids now who actually, when they're feeling panic or they're feeling anything else come on, even at school, they'll jet themselves to the bathroom and they put their hands under cold water. And multiple of my kids have found it really beneficial. Now, again, with any coping skill, though, you're also assuming and hoping that you have somebody's motivated to do it. With true, when depression gets to a certain point, we need other people to motivate us, and we need external help in order to get motivated. If you have an adult who can't get out of bed, then me saying, go for a run is completely insensitive at that point. It has to be tailored to the person. So making sure that there aren't, things in the way to what we're recommending. At that point, you want to make sure they have a good relationship with a psychiatrist and stuff as well, because at sometimes, if we can't, if the emotions are to such a degree that it's too heavy to even access coping skills, then oftentimes that's when we would use medication to bring it down a notch in terms of intensity. And then somebody can actually access the coping skills. Because obviously most of our goal is not to be medicated for the rest of our life. But oftentimes if things are to such a severity, we sometimes need medication to take it down a little bit. And then somebody can access the coping skills that we're trying to get them to use.
I know you mentioned previously in our pre-interview, we're going to probably wait and dive deeper into medicating our children with a psychiatrist. You felt more comfortable with that. In your experience, do you see, because as an outside, not as a professional, obviously, but I did work with a lot of kids, but they were usually at the earliest. I took them as 14 years old because of our sports performance, and they had to be a maturity level at a certain point. And I would see these kids coming in and they would be over medicated, or a lot of the parents would say they have this or that. And I obviously kept it very, that's not my specialty, so I couldn't really talk about it, but the kids usually build a big trust, and I just love children. So they would share with me, and they didn't like the feeling of it, or they would say that the reason why was because my mom was speaking to the neighbor and their son or daughter was on it and was having great results. Yeah. And then the doctor would pass it on. Do you see that happening? That a lot of kids are getting over medicated?
Sure.
Our brain is not, is it, and this is something I need to have information from you, is our brain is not fully developed until 21 or 25. 25. So whatever chemicals we're putting in, and even the best antidepressants or mood stabilizers for a condition is going to have a side effect of something, right? Is they all have side effects, right?
True.
So that's why psychology does it.
Yeah. Right. I mean, child psychiatry, is I give props. I work with a couple of amazing child psychiatrists in the area, and they're wonderful at what they do. And I've had conversations with a couple of them, and they will even say, yes, it's obviously they went to school a very long time and they know exactly what they're doing, but there's a little bit of, I don't know if they would say guesswork. That's my word, probably not theirs, but there's a little bit of experimentation that has to happen when you're medicating a child a little bit, because we don't know from one child, their children's metabolisms are so fast and crazy and changing all the time, and their hormones are going up and down at a certain age and everything. And so, what works for one kid doesn't necessarily work for the next one, and the dosages aren't always the same and stuff. And so, we definitely have situations where, kids, the problem with psychotropic medications too, and I think psychiatrists would agree with me as well, is that oftentimes some of the psychotropic medications have side effects that are pretty uncomfortable, and that then have to be medicated then as well. And so then, that's where you start to get kids, I think, who are, traditionally who parents would call over medicated, are the kids who probably were medicating side effects. And so then sometimes, you'll have a kid who, by the time they're, 12 or 13, they could potentially be on 3 or 4 medications, and I think a lot of parents would call that over medicating for sure. And sometimes it's hard to know, what are they doing anymore? Is the medication working or not? Sometimes the parents, find out, like if they run out of a med or something happens with one of them or something like that, and they don't give it for a few days, they find out real quick if the medication's working or not, also because they get to see a little bit of what's happening behind it. But yeah, child psychiatry is a hard one. And I would say the vast majority of the kids I work with are medicated, because that it is so common in this day and age, for sure. But it also is very common that even the parents that are medicating oftentimes can feel uncomfortable with some of it. And that's where I recommend that they have, that they develop as good of a relationship as possible with their psychiatrist, because I always tell them, just because a psychiatrist writes you a prescription doesn't mean you have to fill it. You're the parent, but at the same time, you're paying for that person's expertise, and their education and everything. And I trust what they say when they talk about my patients to me. And so you want the parent to trust the relationship they have with a psychiatrist, to know that they know what they're doing and they know what's right.
Would you say that this is good advice, or really, I guess it's a case by case situation, is that before you dive into medicating your son or daughter, or even yourself at my age, is that try to exercise, because that's going to help our dopamine and our serotonin levels. Yeah. And cut out sugars, which I'm doing now, I'm trying to do now, because I put on so much weight because of experimental medications they're trying with, and the side effects. Is their natural wellness, which your practice does, yeah. And I'm even looking into other stuff with anti-inflammatory diets that help reduce the swelling of the brain. Try more of a holistic path before you dive into this diet, before you dive into the meds, or is that you can't really say that because
I think there's not a one size fits all, unfortunately, but I absolutely would say that eating, sleep, and activity, right, are the number 3 things in which case, for us to have a healthy body, and our first step towards having a healthy mind. There are definitely barriers to all of those, though, of course. And so, in a total ideal world, people would be getting enough sleep and they'd be getting exercise, and 80% of the time they would be eating well, right? That's in an ideal world. That's what most physicians recommend. Do you know anybody that checks off all of those things? Probably not. I mean, probably not, maybe a few, but probably not too many. So is it ideal? Yes. Those are coping skills that we recommend. Having a healthy body is a huge coping skill. Also, I would also put in here that personally, I don't believe that psychiatry should be used without therapy. I have a real hard time, and the 3 psychiatrists that I use locally in my area all feel very strongly, and they refer to therapists. They feel very strongly that they don't want to be medicating without somebody getting help on the background with other stuff as well. And so we want, the ideal is that a psychiatrist and a psychologist or a therapist or a counselor or whoever you're seeing, that they work hand in hand.
Okay. Perfect. You can feel free to, if you work closely with them and you recommend them, since we have a large audience in South Florida, you can feel free to plug their names right now. If anybody wants to reach out to them, what are the 3 doctors' names that they specialize in child psychology, or a psychiatrist
Actually, all three of them are, I believe all three of them are boarded child, adolescent, and adult. So all three of them are actually also, I believe, as far as I'm aware, still do see adults as well. All three of them, one of the three. So the three that I use in the South Florida area that, again, there's lots of them that are probably really good. The three that I use are Dr. Raj Shakat in Jupiter. I also use Dr. Marshall Teitelbaum, also in Jupiter. And then the third one that also has a specialty in children and has seen probably focuses even more on adults as well is Dr. Michelle Cheney. And all three of them actually practice out of in the Jupiter area as well, but phenomenal psychiatrists and, also recommend therapy and stuff as well, which I think is really well-rounded. We don't want to get to a point where, the ideal is not to get to a point where we're looking for a quick fix and we're medicating, just to medicate. I think we've kind of come full circle because I know in the beginning you were talking about the quick fix and is therapy even that? And no, it's not. And we don't want medication to be that either. We want somebody who kind of learns to, independently and as much as possible, cope with the world around them, in a successful way.
Okay, perfect. All right, so we're gonna close out this session and then we'll be back for our final 2 sessions. Great, thank you.
This concludes Chapter 3 with Dr. Kelly Everson. Make sure to tune in next week, January 6th, for the final chapter, Chapter 4, with Dr. Everson. We strongly encourage you to check out our company website, Concussions, Pain, Mental Health Awareness at cpmha.com, where you can access free resources for coping skills and strategies you may find useful. We also encourage viewers to consider donating to our nonprofit, which helps keeps our mission alive, going strong, and help fund future projects. You can donate through our website at, again, cpmha.com. And remember to like, subscribe, and hit the notification bell in order to receive notifications each time we post a new podcast. Thank you.